Hello everyone, I'm Pharmacist Michael. Most of us have heard about Ozempic and Wegovy. I have done videos on these popular drugs used for diabetes and weight loss before. We know that they can lead to substantial weight loss in patients. After the approval of Wegovy for weight management, demand for these medications skyrocketed. The popularity of these injectable drugs soared to such heights that in May of 2023, the manufacturer, Novo Nordisk, had to halt television advertising to allow for increased production. The rising demand for these drugs raises a crucial issue. To sustain weight loss, individuals may need to remain on these medications indefinitely. This predicament is not surprising, as it holds true for other weight loss interventions as well. However, it poses a potential vexing problem. Existing data indicates that a significant number of people discontinue the use of these drugs after relatively short periods. Why do they stop taking these drugs? What happens to those who are unable to continue taking them? These novel drugs belong to a group called the GLP-1 receptor agonists, or GLP-1RAs. They function by mimicking a hormone that regulates blood sugar levels and curbs appetite by slowing down the digestive process. Although their application in obesity treatment is relatively recent, GLP-1RAs have been approved for managing type 2 diabetes for quite some time. Because of this, we have substantial real-world data on the duration of GLP-1RA usage and the reasons for discontinuation. For instance, one study examined GLP-1RAs prescribed in the UK between 2009 and 2017. Out of 589 patients who started GLP-1RA treatment, 45% discontinued within 12 months and 65% within 24 months. Similarly, a study conducted in the US during a comparable time frame, which included a larger group of diabetes patients, revealed similar rates of drug discontinuation within 12 months. 47% of patients ceased taking their GLP-1RAs, increasing to 70% after 24 months. On average, individuals in that study used the drug for approximately 13 months before discontinuation. Other real-world observations confirm these findings. Approximately half of Spanish patients using a GLP-1RA had discontinued the drug within 2 years, a higher dropout rate compared to other diabetes medications. In Denmark, around 45% of diabetes patients stopped taking GLP-1RAs within 5 years of initiating therapy, although a quarter of them resumed treatment within the following year. In many of these studies, researchers note that people discontinue these types of drugs at much higher rates than during clinical trials. Why is this? Well, clinical trials primarily provide insight into the drug's efficacy and focus on highly controlled settings. In these trials, participants typically receive the medications free of charge and receive regular check-ins from research staff. In the real world, individuals discontinue drug usage for various reasons. A survey involving diabetic patients inquired that their reasons for discontinuing GLP-1RA treatment, both from the patient's and doctor's perspective. Patients who stopped using the drug cited side effects like nausea and diarrhea, dislike of regular self-injections, and disappointment over the lack of weight loss or blood glucose control. In the study, nearly half of patients who discontinued a GLP-1RA cited high cost as a primary factor. If you haven't checked the prices of these drugs, you may be shocked. The price for a monthly dose of Wegovy is almost $1,350, although some insurance plans do cover a portion of this. If these trends persist for weight loss drug usage, which still remains uncertain at present, it might be unrealistic to expect that everyone who begins taking Wegovy or similar drugs will continue using them indefinitely. The UK's National Institute for Health and Care Excellence, which is responsible for determining which drugs are available through the National Health Service, recommends a 2-year limit on prescribing Wegovy for weight loss. It is conceivable that some individuals will discontinue the drug after achieving a certain degree of weight loss and opt for managing their health through diet and exercise instead. It is already known that individuals who discontinue semaglutide tend to regain most of their weight loss during treatment. This raises an important question. If individuals regain the lost weight, are they still better off in the long run compared to those who never lost weight in the first place? Regarding semaglutide, the answer is currently unknown. However, intriguing data suggests that dietary interventions can yield lasting benefits even after they have been discontinued. Some patients will change their habits and learn how to eat in a different way or begin a regular exercise routine. It is possible that as these new weight loss drugs improve, individuals will remain on them for longer durations. Early GLP-1 RAs require daily injections, but Wegovy, Ozempic, and Mounjaro are administered weekly. Pharmaceutical companies are also racing to develop pill versions of these weight loss drugs, as some patients are deferred by the need for regular injections. In May, Novo Nordisk announced successful weight loss outcomes with a semaglutide pill comparable to the injectable version. We know that convenience leads to compliance. If manufacturers can produce drugs that are more affordable and easier to administer, individuals are more likely to maintain usage over extended periods. Additionally, there is reason to believe that adherence rates for weight loss treatments might be higher than for diabetes management. People using GLP-1 RAs for weight loss can often discern relatively quickly whether the drug is effective for them. This positive feedback may increase their likelihood of continued usage, even in the face of side effects. This short feedback could be the path to long-term health benefits. While semaglutide has been shown to aid in weight loss, there are currently no substantial clinical trials that demonstrate whether this weight loss translates into reduced rates of heart disease and stroke, two conditions strongly associated with obesity. In June, a large-scale trial investigating whether semaglutide reduces cardiovascular disease rates concluded after 5 years. And with 17,609 participants, when the results of this trial are published, they will shed light on whether these drugs enhance long-term health outcomes in addition to promoting weight loss. Positive findings could increase the demand for these already sought-after medications. If you know anyone who would benefit from this video, please send it to them. If you've enjoyed this video, give it a thumbs up. And please subscribe to our channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.